Good afternoon and welcome to the American College of Surgeons virtual press conference. My name is Sally Garneski and I'm the ACS Manager of Public Profile and Visibility. One of the conference highlights was on-demand access to hundreds of research in progress abstracts. And we're pleased to welcome surgeons from the University of Alabama at Birmingham Medicine who will share their key findings from their abstracts with us today. The topic is the impact of health literacy on surgical patient outcomes. And now I would like to turn over the screen and the microphone to Dr. Chu.
Well, good afternoon. Thank you all for being here, and thanks to the ACS for this special opportunity. My name is Dan Chu. I am an associate professor and colorectal surgeon at UAB. On the other end is Dr. Tice, a surgery resident at UAB. Our research team is really focused on finding ways to address health disparities in surgery. And it was through this work that we've gotten into the world of health literacy. Now, health literacy is incredibly important and underpins every encounter in health, whether it's at your child's pediatric appointment, your own appointment, or during a surgical experience, as we'll talk about here. So with that, I'm going to turn this over now to Dr. Tice, who will share some of the work that she's spearheaded in health literacy and talk a little bit about what we can do about it.
Thank you, Dr. Chu, for that introduction. Like you said, my name is Lauren Tice. I'm a general surgery resident at the University of Alabama, Birmingham. And I'd like to thank everyone for the opportunity to talk about our work today. And I'd especially like to thank the American College of Surgeons for setting up this press conference for us. I will be talking about how limited health literacy is associated with increased postoperative infection. So first I'll just start by explaining kind of what is health literacy. Health literacy has been defined by a couple groups, namely the National Academy of Medicine, as the ability to obtain, process, and understand health information and services, and use that information to make appropriate health decisions. So there's the first component of understanding and processing the information, but then also being able to utilize that information appropriately. There are many dimensions of health literacy. Print literacy is understanding reading and writing. Quantitative literacy relates to numeracy. Technology literacy is the ability to effectively operate a computer or other technological platforms. Oral literacy is understanding speaking and listening, so as in a patient-provider conversation. Visual literacy is understanding and assessing graphics and images. And information literacy is obtaining and applying information, so maybe navigating from the parking deck to a clinic space, things like that. Patients may be lacking in one or many areas of health literacy, so it's important to understand that there are many different components when it comes to health literacy. So why does this matter? Well, studies show that 9 out of 10 adults have difficulty using health information in healthcare facilities and media. And work from our group has shown that more than 30% of surgical patients have low and limited health literacy. This is just a basic heat map of health literacy levels in the United States. And you can see, particularly in the Southeast, there's a lot of red and orange being basic and below basic health literacy levels. And in particular, in Alabama, many of the patients that we serve have low and limited health literacy. And so we believe that we are uniquely poised to study this problem, given our very special patient population that we serve at UAB. In addition, surgical patients often need to obtain, process, and understand health information throughout their surgical journey. The surgical journey is really complex. It usually involves preoperative clinic visits, complex decision-making regarding procedures and interventions, an inpatient stay and operation, and then discharge home with sometimes a new ostomy, a new drain, a new wound. There's usually postoperative instructions and care plans that patients need to follow at home too. So you can see there's many ways that surgical patients interface with the healthcare system, and there are many times that they can receive very difficult information, and it can be especially challenging for patients with low and limited health literacy. So to study this, we conducted a study of 270 patients undergoing colorectal surgery at our institution in Birmingham, Alabama, between 2018 and 2019. These patients had their health literacy level measured using the brief health literacy screening tool, which is a 4-question screening tool that is administered by our clinic nurses at a patient's first clinic visit in our colorectal surgery clinic. Then we stratified patients into 3 different groups based on their health literacy. We had 19 patients with low or limited health literacy, 38 patients with marginal health literacy, and 213 patients with adequate health literacy. We then assessed different postoperative outcomes, including using the ACS NSQIP database, including length of stay, readmissions, and rates of complications after surgery. And what we found was that patients with limited and low health literacy were particularly high risk for infectious complications after surgery. So you can see here that patients with limited health literacy had a rate of about 37% of infectious complications compared to between 10 and 15% for marginal and adequate health literacy patients. So this limited health literacy group is really high risk for infectious complications in our study. And these include a number of different complications. So surgical site infections, deep space and organ space infections, which for this patient population would be mostly in the abdomen or the pelvis, wound complications, and then other infectious complications after surgery, such as pneumonia, UTIs or urinary tract infections, C. diff, sepsis, and septic shock. When we did an adjusted model, so adjusting for other patient level factors, such as, if they take many medications or they have pre-existing conditions, we still found that patients with limited health literacy have 4.5 higher odds of infection after surgery than patients with adequate health literacy in our study. So the question remains, what can we do now that we know that this group of patients with limited and low health literacy is really high risk for infectious complications? What can we do to help mitigate those disparities? Well, there's a number of interventions that have been well described in the literature and that we've been employing at our institution, and I'll just briefly go through a few of those here. The first thing we can do is work to improve patient education materials, focusing really heavily on visual and graphical representations. So patient education materials being written materials that patients receive really any time throughout the surgical process, whether that's preoperatively as part of pre-op education on the surgery that they're going to receive, whether that's in the hospital, whether that's given to them at the time of discharge or even available to them after they go home. Working to improve those materials can be really helpful for all patients. The other thing we have studied and talk about is how to optimize patient-provider communication. And we have found that speaking slowly, using plain language and teach-back techniques is key in effectively communicating with patients of all health literacy levels, but particularly those with low and limited health literacy. We've also begun to leverage some patient engagement technologies. Patient engagement technologies are usually app-based or web-based platforms that help guide and navigate patients through the surgical journey. And I'll talk a little bit about each of these things. So the first thing I want to highlight is improving patient education materials, especially with visuals. This is just some example of some education materials from our institution. So you can see version 1. And I know it's small and you can't read it, but the main point being here, these were the materials patients were receiving about our enhanced recovery protocol, which is a collection of best practices around the time of surgery that has been shown to improve patient outcomes. We'd like to provide some patients with some background info on that protocol. And version 1 was the first version of materials we were giving patients. So you can see it's just a white background with text. There's no graphs, there's no images, there's no visuals. It's just a lot of words. So for a patient with low or limited health literacy, that could be really confusing and difficult to interpret. So we moved to version 2. We used the help of our Patient Advisory Council, which is a group of patients and family members that we meet with regularly at UAB, and got their input on this process. Moved to version 2. And you can see that it's a little better. We've got a lot of images and visuals, but there's still not a lot of white space. There's still several words. The background colors can be confusing. And ultimately, we ended up with version 4, which is our final version of the materials that patients receive today. And again, it's small, but just to highlight that it's mostly images. It's visually based. There's very few words. The words are very, very simple and very plain language. So rather than saying that you would have your catheter removed, we say you would have your pee bag removed. Things like that that are very understandable for patients. So We measured the grade level of these materials. The CDC recommends that patient education materials be written about the 6th grade level. The first set of materials were written at the 9th and 9.5 grade level. Through stakeholder engagement and using patients and their family members to help optimize these materials, we were able to improve the readability of the last version here down to the 6th and 7th grade level. So the lesson here being that you can make print materials more understandable for patients. Next, I'll talk a little bit about some communication characteristics and techniques that can be helpful in communicating with patients with low and limited health literacy. On the left is a graph of some of our data from recording and observing patient-provider conversations in the clinic at UAB. And what we found is that as physicians speak faster, they are less understandable to the patient. So the understandability of the words that they use and the conversation decreases with an increasing speed of conversation. So it's really essential to speak slow and use plain, clear language. A good example of some plain and clear language is here on the right. So the FKGL is the Flesch-Kincaid grade level, higher being harder to understand, lower being easier to understand. And when we use words like strenuous, anesthesia, narcotic, incision, those words can be very difficult for patients to understand. Alternatives would include simple, plain language like hard or put you to sleep instead of anesthesia, pain meds instead of narcotics, and scar instead of incision. And you can see that the FKGL level for those is much lower. And then teach back, and I don't have a graphic for this, but just in general, explaining to a patient, talking to them about the procedure, talking about their options for therapy, ask the patient to repeat it back to you, and then you can see how much of that they understood and which gaps in their knowledge you can help fill in. This is I'll talk a little bit about our patient engagement technologies. At UAB, our platform that we use is Seamless MD. That's an app that patients can access on their phone, a tablet, a computer, from the time that they enroll in the clinic before surgery, all the way through their surgical, through their hospital stay, and even after discharge. And it does a number of things, including reminding patients to take their bowel prep, and it provides these education materials as well that can be accessible to the patient at any time. And these are just some examples of the educational materials that are featured on that app platform. On the left, you can see a visual description of how to prepare the bowel prep before a surgery. So even just demonstrating how to pour the Miralax into a Gatorade is really helpful for patients of all levels of health literacy, but particularly those that have low and limited health literacy. On the right, several of our patients will leave the hospital with new ostomies, and that can be really difficult for them to take care of, and difficult for their family members to take care of. And here's some basic instructions on how to empty an ostomy bag. And those are available in the app anytime if they need to refer back to them. And again, you can see that it's primarily visually based with few words and very simple, plain language. So just wanted to highlight some of those materials. And lastly, I'll close with just kind of highlighting a few of the toolkits and available free resources on the internet. So there are a number of toolkits and resources available to institutions, individuals, organizations that are interested in employing some of these techniques in their communication with patients. So the one on the left is the Agency for Healthcare Research and Quality. They have a wonderful toolkit called the Health Literacy Universal Precautions Toolkit. They've got a number of tools, techniques, resources that are available for free on their website. And I especially like to highlight this one because I like that they call it the Universal Precautions Toolkit, and that comes from the concept that we should take universal precautions with our patients when it comes to health literacy, rather than only employing these techniques with patients that we know have low and limited health literacy. We should assume that all patients have low and limited health literacy and employ these techniques across the board as a universal precaution to help optimize our communication with those patients. And on the right, the CDC, through their Plain Language Initiative, has a number of materials and resources as well that highlight ways to improve and optimize some written materials and communication skills as well. And with that, I'd like to thank everyone that's involved in this project. Really, really appreciate the help that everyone has given us. This is a project that we are very passionate about and we feel very strongly about. And I look forward to taking any questions. I will highlight on the right, this picture is members of our group when we met Governor Kay Ivey last year. She declared last October to be Health Literacy Month in the state of Alabama. So it's great to see that this health literacy is gaining increasing recognition and people are starting to realize how important it is in establishing patient outcomes. Thank you so much.
Okay, so thank you to Dr. Tice and Dr. Chu for this very important topic, and that we think will assist surgical teams in helping their patients become more informed and more empowered throughout their surgical journey. Thank you very much.
Thank you all very much.
Absolutely. Thank you for this opportunity to talk about our work.